Have you ever wondered if walking every day might not be enough? Or even the wrong choice for your heart? Sounds shocking, but in recent years, some of the world's most respected heart surgeons and cardiovascular centers have started to say something surprising. Walking is no longer the best recommendation for heart health. Now, we're not telling you to stop moving. But what if you've been doing it the wrong way? Or worse, what if you're ignoring the real habits that clean your blood vessels, strengthen your heart, and keep your circulation flowing like it did in your younger years? And here's the twist. These habits are much simpler than you'd expect. Some take just 2 minutes a day. Others you can do while sitting in a chair. And all of them share one thing in common. They come from experienced cardiologists who treat people over 60 every day. If you have high blood pressure or cholesterol, feel tired going upstairs, or simply want to protect yourself from heart trouble in the future, then you need to stay with us. Because tip number 4 is now being used in clinics to prevent unnecessary heart surgeries. And at the end of this video, we'll give you a special bonus of 3-minute daily ritual that may help reduce artery stiffness and naturally clean your blood, based on a recent European study. Before we begin, make sure to like this video, subscribe to Health and Vigor, and comment the number 2 if you walk every day so we know you're with us. Let's get into the 5 daily habits that may be better than walking for your heart and blood health. Part 1. Deep diaphragmatic breathing 5 minutes after waking up. Did you know that something as simple as breathing deeply through your diaphragm can directly impact your blood pressure, heart rate, and blood vessel health? It's true. Most older adults wake up already tense, full of thoughts, phone notifications, or yesterday's worries. But that activates the sympathetic nervous system, which raises your blood pressure, speeds up your heartbeat, and puts your body in stress mode. Now imagine doing the exact opposite. Diaphragmatic breathing, also known as abdominal breathing, activates your parasympathetic nervous system, the one responsible for slowing your heart rate, relaxing your blood vessels, and lowering cortisol, the stress hormone. And that's not all. Studies published in journals like Hypertension Research show that just 5 minutes of this breathing per day can lower systolic blood pressure by up to 10 points, increase heart rate variability, a marker of cardiovascular health, and even improve blood flow to your brain and limbs. How to do it? When you wake up, sit up in bed, place one hand on your chest and one on your belly. Inhale slowly through your nose for 4 seconds, letting your belly rise. Then exhale through your mouth for 6 seconds, letting your body relax. Repeat this cycle for 5 minutes. That's it. No sneakers, no walking, no leaving the house. But the effects on your heart are deep and long-lasting. Sounds too simple to be real? Try it for 7 days straight and see how you feel. You might discover that true healing begins with the way you breathe. If you're still with us, like this video and comment the number 1 below so we know you're following along. Part 2. Isometric muscle contractions without leaving your chair. If you think you need to walk 40 minutes a day to activate your circulation, think again. One of the most underrated techniques for supporting cardiovascular health, especially For people over 60 is isometric exercise. And the best part, you do it while sitting. So what exactly are isometric contractions? Unlike traditional exercises that involve movement like walking or lifting weights, isometric movements involve tensing a muscle without changing the joint angle. In other words, you contract and hold. And why does that help the heart? Studies have shown that when you do short isometric holds like squeezing your hands together, tightening your thighs, or pressing your feet into the floor, it creates temporary internal pressure in the muscles that pushes blood more forcefully through your vessels over time. This process improves blood vessel strength, increases arterial elasticity, and can help reduce resting blood pressure. One study in the Journal of the American Heart Association found that seniors who practiced simple isometric holds 3 times per week had significant improvements in blood pressure and in their cardiovascular systems. Response to stress. Here's a simple example. Sit in a firm chair. Press your feet into the floor with moderate force like you're trying to push the floor down. Hold for 10 seconds. Then relax. Repeat 5 times. Next, do the same by tightening your glutes and thighs. It's simple. It's safe. And for many older adults with joint pain, weakness, or limited mobility, it can be more effective than walking. And the best part, you're activating your entire vascular system without even standing up. If you're still with us, like this video and comment the number to below so we know you're following along. Part 3: Hot and Cold Contrast Showers Natural Vascular Stimulation. Very few people know this, but there's a simple, natural, and science-backed way to exercise your blood vessels without leaving your home. It's called contrast hydrotherapy, alternating between hot and cold water. But how does it work? When you're exposed to hot water, your blood vessels expand, vasodilation. When you switch to cold water, they contract, vasoconstriction. This back and forth creates an invisible workout for your circulatory system, as if your blood vessels are stretching and relaxing in cycles. And the benefits are powerful. Improved peripheral circulation, reduced inflammation, enhanced venous return, especially in the legs, and even lower blood pressure. According to studies from Europe and Japan. Plus, this habit boosts tissue oxygenation, stimulates your immune system, and may even reduce joint pain in older adults. How to do it? During your shower, after washing as usual, apply 30 seconds of cold water to your legs and arms, followed by 1 minute of hot water. Repeat this cycle 3 to 5 times. Always finish with cold water to close the pores and give your circulation one last push. Important if you're sensitive to cold or have serious heart conditions. Consult a professional first. But for most healthy seniors, this routine is safe, energizing, and highly effective. It may feel like just a shower, but for your circulatory system, it's almost like a mini physical therapy session. If you're still with us, like this video and comment the number 3 below to let us know you're following along. Part for Heart Coherence, the invisible workout for your heart and brain. Imagine an exercise that synchronizes your heartbeat with your breath, improves circulation, calms your mind, and even reduces your risk of heart attack and stroke. It exists. And it's called heart coherence. Little known to the public. Heart coherence has been studied for years by institutions like the HeartMath Institute and major universities in France, the US, and Japan. It's based on one powerful discovery. When you breathe in a steady, rhythmic pattern, your heart enters a state of harmony with your nervous system, reducing oxidative stress, improving blood flow, and stabilizing blood pressure. So how does it work? It's like a guided breathing meditation. You inhale for 5 seconds, exhale for 5 seconds, and continue this rhythm for 5 minutes, ideally 2 to 3 times a day. And the effects: a drop in blood pressure by up to 15% in clinical trials, improved blood flow to the brain, decreased vascular inflammation, and a boost in heart rate variability, a key marker of cardiovascular resilience. In fact, heart coherence acts like a reset button for your nervous system, enhancing sleep, focus, and even mood. It's so effective that some European hospitals now use it to prepare patients before heart surgery, because it reduces anxiety and stabilizes vital signs. How to practice: sit comfortably, close your eyes, and breathe in through your nose for 5 seconds. Then out through your mouth for 5 seconds. You can even use visual guides or breathing apps to help you stay in rhythm. This is one of those habits that requires no physical effort, but offers deep physiological benefits for your heart, brain, and overall circulation. If you're still with us, like this video and comment the number for below so we know you're following along. Part 5. Eating natural vasodilator compounds, the secret most cardiologists keep. Did you know that what you put on your plate every day can be one of the biggest allies or enemies of your heart and blood circulation? And we're not just talking about avoiding fried foods or sugar. The secret is adding foods rich in natural compounds that promote vasodilation, meaning they open up your blood vessels, improving blood flow and lowering blood pressure. These foods help to reduce artery stiffness, lower the risk of blood clots, and improve tissue oxygenation. So, what are the champions recommended by cardiologists? Beetroot rich in natural nitrates that convert to nitric oxide in the body. A powerful vasodilator, raw garlic known to improve circulation and reduce blood pressure. Dark cocoa full of flavonoids that relax blood vessels. Ginger helps circulation and has anti-inflammatory effects. Green tea contains antioxidants that protect vascular lining. Closing parenthesis. How to consume them. The tip is to eat these foods in their most natural form, such as juices, teas, or small portions in meals. For example, a glass of beetroot juice in the morning, raw chopped garlic in salads, a square of 85% dark chocolate after meals, hot green tea throughout the day, and fresh ginger tea or juice. A study published in the American Journal of Clinical Nutrition found that people who regularly consumed these foods had significant improvement in vascular function and lower blood pressure in just 4 weeks. So food can be true heart medicine, easy, affordable, and delicious. If you're still with us, like this video and comment the number 5 below to let us know you're following along. You've just discovered 5 habits that according to top cardiologists, are far more effective for your heart and blood health than just going out for a walk. But remember, real change happens when we turn knowledge into daily action. So here's the invitation: start applying these practices today, one by one, and watch how your body responds. And to make it even easier, I've prepared a special bonus for you. A simple 3-minute ritual that combines breathing, stretching, and circulation stimulation, which may help reduce artery stiffness and naturally cleanse your blood. Want to get this bonus? It's in the video description. Just click and download it for free if you liked this content. Don't forget to like the video, subscribe to Health and Vigor, and comment below which habit you will start today or which one you already practice. Your participation really helps us create more videos that make a real difference for you. And those you love. Thank you so much for watching until the end. See you in the next video with more health and vigor for your life.